believe, or at least I hope, that I've established that the healthcare economy will continue to grow and that your communities must act to capture their fair share. But let me state the obvious. This is a complicated, nuanced topic. Healthcare has both challenges and opportunities, the yin and the yang. The cost of healthcare can be painful, very painful, particularly if you are a business owner who is paying for care for your employees as well as for your family and yourself. Because healthcare will continue to grow its share of the GDP, policymakers and the healthcare community have a greater obligation than ever to work together to deliver value for the healthcare dollar. But why isn't this the responsibility of the healthcare sector alone? The answer is simple. Healthcare is a public good. Caring for sick people is a social and moral obligation that extends beyond the commercial realm. In the U.S. and Canada alike, we have decided that we will not allow people to suffer and die in our streets. In the U.S., our system is designed to let patients make irrational choices. An acquaintance is 85 years old and has had 6 knee replacements. Why? Because he loves to ski. If healthcare is a public good, how can we justify giving an octogenarian a new knee every other year at $50,000 to $80,000 a pop? No matter who gets the bill, we all pay. One of the fundamental reasons U.S. healthcare costs so much is that we collectively have such high service expectations. We want our 6 knee replacements. You may ask why this person's physician doesn't just say no after the 2nd or 3rd knee replacement. The basic principle influencing the doctor-patient relationship is the Oath of Geneva, a modern rendition of the Hippocratic Oath. You've probably heard the phrase, "first do no harm." You might be surprised to discover that those words don't actually appear anywhere in the text. One of the key phrases is, "I will apply for the benefit of the sick all measures which are required." In other words, the oath that every physician takes is to be an advocate for his or her patients. That's why I say the medical community cannot and should not by itself solve the question of what is the best use of resources in the aggregate. It is against our very nature and training as physicians. What we need are policies that maximize the public benefit. I would argue the ethical imperative is to provide the best care for the most people with the resources available. We can do that by the use of statistical data and evidence-based practices.